Are you aware that fibroids are one of the leading causes of infertility in women? By the way, do you know what fibroids are, their causes, treatment, and how you can prevent fibroids? Watch this video. We shall be entering the depth about fibroids and infertility.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel. This is your channel where you learn medicine at the comfort of your living room. Find us on all our social media platforms. Ask any question of your choice. We shall be right there to answer you. And for those of you who would like to have a private chat, a private consultation with me, go to our website www.drothman.com and book an appointment. And also those of you who ask from our timelines on different social media platforms, at times we take long to answer you because of a very large volume of questions. So if you find your question taking long, you can still go to our website and book an appointment, or else you can still go to our website and find some information. We usually put a lot of information, and you may find that the question you're asking is right there on our website, and you can read and get a solution to your problem. Today we are talking about fibroids. Why? Because fibroids are one of the leading causes of infertility, and we are in our second episode about infertility. In the last episode we discussed generally about infertility. We looked at how a child is formed, how fertilization occurs, how a child is formed, how a child is kept in the mother's womb, and how birth occurs normally. And we also looked at areas where problems can happen for someone to fail to conceive, and that is infertility. So in this episode, we would like to specifically look at one disease that can cause infertility, and that is fibroids. What are fibroids? Again, we have to look at the reproductive system of a woman. If you look at this system, we have the uterus. And we talked about the uterus the other time as the area where, number one, sperms swim through to reach the egg. Number two, as the area that keeps the baby. And as the area that also contracts to push the baby out. When we are looking at fibroids, we want to understand these things. What is a fibroid? A fibroid is a mass, call it a swelling, that is found in the uterus. This swelling is not a cancer, and that's why in science we call it a benign tumor or a benign swelling, because it's not cancerous. These swellings can range in size. They can begin from a size of a rice grain to a size of a fist, and even more. These fibroids have different types, and we get types according to where they have grown or which part of the uterus the fibroid has grown. So we have what we call the subserosal fibroid. So this fibroid grows out just like outside of the uterus, in this area of the uterus, just around here. A mass can grow, a swelling can grow from there. This is a fibroid. And you'll find doctors calling it a subserosal fibroid. Don't mind about those terms. Just mind about where the fibroid is. So this can be a subserosal fibroid, which is just at the outer lining of the uterus. We have other fibroids, or another type of fibroids called the intramural. The intramural is found just within the muscle, within the uterine muscle. When you look outside, you not see it. When you look inside, again, you not see it. But it is just within, in the middle of the muscles. And that is an intramural fibroid. We also have the submucosal fibroid, or a fibroid that is found within the lining, inside the lining of the uterus. And that is this area. This is another fibroid, and it is called the submucosal fibroid. So, usually, the doctors will tell you, you have a fibroid, and this fibroid is subserosal, this fibroid is intramural, this fibroid is submucosal. Just know, when they say submucosal, it means your fibroid is inside the lining of your uterus. When they say intramural, it means it's in the middle of the muscles of the uterus. And when they say it is subserosal, it means it's just outside the outer lining of your uterus. So those are the different types of fibroids. Now someone wants to know what causes these fibroids. What happens? Why should someone get fibroids? Now, I want you to understand that the cause or the main causes of fibroids is generally not known. Doctors don't know what causes fibroids. However, there are some research which have been done and they are pointing towards some factors that can lead to the formation of fibroids. However, generally, because you find someone with a fibroid and you look for any cause, because I'm going to talk about a few causes here, but someone comes is having a fibroid, you look at all those causes and there is none, but someone has a fibroid. And therefore, we call that idiopathic, meaning that largely the cause of fibroids is not known. However, most people that have had fibroids have the following factors, and therefore most researchers confirm or most researchers believe that the following are the causes of fibroids. Number one, prolonged exposure to estrogen. Prolonged exposure to estrogen. What do I mean here? In the other episode, we talked about two hormones, progesterone and estrogen. These two hormones, progesterone and estrogen, work like co-wives. What do I mean? These two hormones work like one is in the government and the other one is in the opposition. What the other one does is the reverse of the other hormone. So, we talked about progesterone in the other episode and we said that progesterone is a hormone of pregnancy. So, when someone conceives, during that period, they have high levels of progesterone. And therefore, when there are high levels of progesterone, the levels of estrogen go low. It's like almost someone has no estrogen. In very little amounts, you'll find it there. But in very little amounts as compared to progesterone. Now, when someone delivers, then the levels of estrogen will go high and progesterone will go low. I don't know if you guys are understanding me. I talked about a hormone of pregnancy called progesterone. And there is also another hormone called estrogen. These two hormones work antagonistically. One is in the opposition, another one is in the government. So, when you are pregnant, the levels of progesterone are high. But once you give birth, progesterone goes low and then estrogen shoots. Now, when you get long exposures to estrogen, what do I mean? People who take long to produce. Someone enters there 30 years. You've not yet gotten pregnant. 35 and so on. Just know that you are now a culprit. You're becoming a candidate for a fibroid. Because your progesterone levels are low and then estrogen is high. And the uterus is exposed to high levels of estrogen. And therefore you may end up with a fibroid. And that's why for all people with fibroids, when you look at their histories, you'll find that they have spent a long time without giving birth. Actually, another risk factor is those people who begin menstruation early. Someone who begins menstruation early at 8 years, they are starting menstruation, and they take long. They don't get pregnant, 30 years, 35. They are exposed to high levels of estrogen and low levels of progesterone. Therefore, they are candidates for getting fibroids. So, what happens exactly? What happens exactly for someone to get a fibroid because of prolonged exposure to estrogen levels, to high estrogen levels? I said progesterone is a hormone of pregnancy. So when progesterone is there, there is a pregnancy. Someone is pregnant. Now when progesterone goes away and you now have estrogen, someone doesn't have a baby, the uterus will demand. When time passes, the uterus feels like it should have a baby. The ovaries feel like the baby should be there. And therefore, there is going to be hormonal interplay there. And then there will be communication. The uterus will want to have a baby. Therefore, the uterus will form a doll. The uterus will not form a real baby, but it will form a doll. It's like when you don't have someone, if a child doesn't have, if you don't have a child, you can have a teddy bear. So this uterus is also going to form a teddy bear, and it will grow like a baby. Therefore, when there is something, the uterus will feel like, yeah, there is a baby inside. And that's how people end up with fibroids. So that is a major factor for someone to get fibroids. Secondly, these fibroids have been linked to genetic causes. And there are some people with genes that can lead to formation of fibroids in their body. And that's why fibroids are hereditary. You'll find that a certain family, some people are getting fibroids when the mother had a fibroid, the daughter is having a fibroid, the grandchild is having a fibroid. So you'll find that the fibroid is running through the families. So when we are talking about these fibroids, we talk about them passionately. Why? Because they are leading to a very big problem of infertility to many women in the world. Another risk factor for getting fibroids is age. We talked about when someone is above 35 years. When you're above 35 years, remember there is that long exposure to estrogen for all that period of time. And if it's coupled with non-childbirth or non-getting pregnant, then at the end of the day, you may end up with a fibroid. Other factors include vitamin D deficiency. People with vitamin D deficiency are also culprits, or they are candidates for getting fibroids. So we now need to look at the signs and symptoms. How do you know that you have a fibroid? Actually, most of these fibroids are asymptomatic. What I mean by asymptomatic is that most of them, someone cannot realize that they have them. Most of them, actually around 80% of them, come unnoticed. Someone spends with a fibroid for a period of 5 years and is not aware that the fibroid is there. And actually most of these fibroids are incidental findings. Someone comes with something else, with another disease, you do an ultrasound scan and you find a fibroid there. And may say, no doctor, you're lying. I don't have a swelling in my abdomen. I don't have a swelling in my uterus. They will deny, but most of them do not have signs and symptoms. However, those that have signs and symptoms, the following can happen to a person with a fibroid. Number one is lower abdominal pain. These people get lower abdominal pains, that is pain below the umbilical region. And secondly, which is also the most common, is prolonged and heavy bleeding during menstruation. Also, on the same issue of menstruation, these people can have intermenstrual bleeding, whereby someone bleeds in between their cycles. So, if you see such signs, you have some lower abdominal pain, you have intermenstrual bleeding and heavy prolonged bleeding, it should trickle into your mind that probably you may have a fibroid and you may need to go to the hospital for a checkup. Other signs come as a result of increase in size of the fibroid. When this fibroid increases in size, it causes pressure symptoms, and people will now present with increased mutilation, whereby every time someone wants to go and do susu, every time you want to go and urinate, that can be a sign of fibroid, that is the size has increased and is now causing what we call pressure symptoms. Constipation, lower back pain, and so on can be some of the signs of a fibroid. And therefore, if you have such signs, you may need to go to the hospital for a check. So if you have a fibroid, because we've said some of them are symptomatic, you may not get to know the signs and symptoms, you may not have the signs and symptoms. What should you do? Go to the hospital, and one of the easiest tests that will be done is the imaging, and that is the ultrasound scan. When an ultrasound scan is done, it can see a fibroid. Very easy. You don't need to struggle. Very easy, because an ultrasound scan is non-invasive, non-painful, so you'll be able to detect whether you have a fibroid or not. There are also X-rays like an HSG, hysterosalpingogram. That is an X-ray where they first introduce a dye, and that can also be able to visualize or to indicate to you that you have a fibroid. Now, another major question should be, are these fibroids treatable? Can I treat them? Can I treat the fibroid? Yes, fibroids can be treated. How? There is number one, the medical treatment, but also the surgical treatment of fibroids. Now, if you look at the medical treatment, because we generally believe, there is a general belief that that prolonged exposure, too much estrogen in the body for a long period of time can lead to formation of these swellings, of these fibroids. Now, if you're giving a medicine for fibroids, you have to target the estrogen levels. And therefore, largely, we are using hormonal intrauterine contraceptive devices, what we call a hormonal Iud. One of my previous videos, I talked about an IUD, but the IUD I talked about was the copper-T IUD, and that is an IUD that doesn't have hormones. But there is also another IUD which is hormonal bearing. It contains a hormone called progesterone. So it's a slowly releasing hormone. It's a slowly releasing hormone. Progesterone is released in the body slowly, and it can be able to treat a fibroid. Largely also we use gonadotrophin releasing substances or products or agonists. Those agonists can be able to also reduce and shrink the size of the fibroid. There are several other treatments. You can also use family planning pills, the progesterone only pills, because if you look at these oral contraceptive pills or the oral family planning pills, those tablets you swallow for family planning, they are of two types. There are those, they tell you this one is supposed to be taken, it can be taken by anyone. Anyone can swallow it. But again, they say, if you are breastfeeding, you're not supposed to take this. So it means there are two types of contraceptive pills. The progesterone-only pills, and those are the pills we give to breastfeeding mothers. And there are also these other pills that have both the yellow and then the brown color. So if you have a fibroid, we may advise to take the other white pills, those that are progesterone only. We call them POP, progesterone only pills. The ones taken by a woman who is breastfeeding or a lactating mother. So those pills can also be able to shrink the fibroid. Why? Because they contain progesterone. And I told you progesterone is an opposition leader versus the government, which is estrogen. Therefore, when you introduce progesterone in the body, it is going to lower the levels of estrogen, and therefore it will suppress the growth of this swelling. Largely, these swellings may not go off, may not go away completely with medical treatment, and therefore they may require a surgery. Therefore, this requires a discussion between you and your doctor to look at very many factors. Number one, the size of your fibroid. Number two, the type. Where is the fibroid? Number three, your fertility intentions. Do you want to have children, more children, or you don't want? You've never produced, or you have many children you may not need. So that is what we call fertility intentions. What are your intentions as far as childbearing is concerned? So after looking at that, then you can decide on the other medicals I talked about, or the surgery. Which surgery can be done? We call it myomectomy. Myomectomy. What we mean by myomectomy? Simple. We just cut just below the umbilicus. We make a very small incision. We go into, we got the uterus. We look at it. We examine it. We look for where the swelling is and remove it. And just cut it out. We stop the bleeding, and you get fine. That is called a myomectomy. However, there are those swellings that are really too big, and they have occupied almost the entire area of the fibroid. And also depending on the type, whether it is, especially the intramural, these ones which are in between the muscles, this and this. So those two fibroids, when you look at their size and other features which need to be discussed with your doctor and your family, we may decide to say, let's do a hysterectomy. Hysterectomy can be subtotal or total. What I mean by hysterectomy is removing the uterus. Removing the uterus. And that can be either removing a small part of the uterus, that is what we call the subtotal, or the whole of the uterus. But I told you this will depend on your individualized talk with the doctor, your family, and so on, to look at, number one, size of the uterus, size of the fibroid, position of the fibroid, and then also the fertility intentions of you as an individual to come up with a decision. Now, I know you're all wondering, how is this fibroid causing me to have infertility? How is this fibroid causing me not to get pregnant? I have talked about it a little bit. But again, just assume that there are fibroids here, multiple of them, or just one fibroid. How is implantation going to occur? Because remember, we said that after fertilization, the baby has to come and implant, or it attaches itself on the wall of the uterus. How is implantation going to occur amidst these big swellings? So you can end up with infertility. Secondly, these swellings can interfere with the movement of sperms. Imagine sperms have been deposited here and they want to pass through, they want to swim. How will they pass through this area, which is full of swellings? At the end of the day, the sperm may not be able to reach the ovum, and therefore fertilization may not occur. Therefore, these swellings or these masses make the conditions unfavorable for the sperm to propel or to swim to reach the ovum. And they can also make conditions unfavorable for the zygote or the baby which has been formed to implant in this area. And that's how a fibroid causes infertility. I told you that if you want to have a private chat with me, you want to ask me a question privately, go to our website www.druthman.com and book an appointment. I will be with you. We shall discuss and look at how you can solve your issues. So, how can you prevent fibroids? What do you need to prevent fibroids? Number one, bear children. Don't take long without getting pregnant. That is one of the issues you should look at. Don't take long. 2, use some hormonal contraceptive pills, especially if you know you are at risk of getting these fibroids, because we've looked at the risk factors. We've talked about a hormonal Iud. You can use it if you really see that you're in that category of people that can get fibroids. However, still, before using all this we are talking about, have a talk with your doctor. Let you have an advice, because yes, I am talking about a hormonal IUD as far as fibroids are concerned, but it also has its own side effects. And that's why you'll find that largely people prefer copper T IUDs. So this will require you to sit down with your doctor and discuss about it. Thirdly, if you would like to prevent yourself from getting fibroids, keep a normal weight. Keep a normal weight. I didn't talk about it in the risk factors, but obesity is one of the risk factors for getting fibroids. Because when you are obese, there is increased secretion of estrogen in your body. And because there is increased secretion of estrogen in the body, you're exposed to getting fibroids. Therefore, keep normal weights, do workouts, exercise, take a lot of vegetables and fruits to increase your vitamin D's and vitamin C's in your body. Thank you very much for watching Ask Dr. Uthman YouTube channel. This is your channel where you learn medicine at the comfort of your living room. If you would like to chat with me privately, I told you what to do. www.druthman.com. Book an appointment. We shall find ourselves there.
Ask Dr. Othman.